Dear students, welcome back. In the part 1, we have seen the introduction and some of the parts of the sacrum, that is apex and base. In this session, we are going to see the surfaces of the sacrum. The surfaces of the sacrum consists of pelvic surface or anterior view, dorsal surface and the lateral surface. Now, first we will see the anterior view or pelvic view of the sacrum. And this one is concave all over. The surface appears to be concave like this. If you see on the lateral view, it appears as concave, as well as when we see this anterior view, the bone appears as concave. And it is having broader upper part and which is directed downwards and forwards. So this upper part is broader and which is directed downwards and forwards. Okay, and it has 4 pairs of pelvic sacral foramen. It consists of 4 pairs of pelvic sacral foramens. So here you can see the pelvic foramens on either side, which communicate through intervertebral foramen with the sacral canal. Actually, the sacral canal, which is present on the dorsal aspect, which is formed by the vertebral foramens of all the sacral vertebrae, and that sacral canal is communicating with the sacral foramen. Okay, through sacral canal. So, what are the structures passing through this sacral foramen are? They transmit ventral rami of upper 4 sacral nerves and a branch from lateral sacral artery. If you can see here, each foramen consists of one nerve and one artery. The nerve is nothing but it is the primary ventral rami of the sacral nerve. So 4 pairs of primary rami or ventral rami of the upper 4 sacral nerves and also a branch of sacral artery. Okay. And coming to the next area, this area is called as median area. What do you call? This area is called as median area. This area is between the foramen of right and left sides. So here this is the median area. You can see it here very clearly. So this is the median area. So which is present in between the right and left sacral foramens, and this median area is formed by the flat pelvic surfaces of the bodies of the sacral vertebrae. Here you can see the bodies here. So 1, 2, 3, 4 and 5. So the bodies of all the sacral vertebrae forms this median area, and also in between each body will have a line of fusion of sacral vertebrae or seen, and as it is raised of 4 transverse ridges. So 5 sacral vertebrae are fused. So that fusion can be seen as raised transverse ridges. Here you can see the transverse ridges. So 1, 2, 3 and 4 transverse ridges separating the bodies, and these ridges are called as line of fusion. Okay, and here another important thing, there are bars of bone which separate the foramen from one another on each side, present as costal element. So here you can see this bar of bone with separating each foramen. So here you can see this is the bars, okay, bars of bone which separate the foramen from one another on each side. So on each side it is having, in this side you'll have some muscle attachment here. So in this this is left and right side. On the left side you can see here very clearly. So these bars of bones are called as the costal element. Okay. And surface lateral to the sacral foramen on each side is formed by the fusion of costal elements or costal elements to one another. So this surface is formed by this fusion of all these costal elements, forming the surface lateral to the sacral foramen. So here this is about the pelvic surface. Now coming to the attachments. In this, the attachments mainly is by the piriformis muscle. The piriformis muscle, here you can see on the right side, this piriformis muscle arises on each side of the pelvic surface. So both right side and left side, this muscle arises opposite to second, third and fourth sacral vertebrae and form the bars separating sacral foramen. So that means over the bars it is getting attached. Over the muscle lies lumbosacral trunk. So here you can see this lumbosacral trunk. On the base I have told that on the medial aspect this lumbosacral trunk is present. So this lumbosacral trunk will lie over this muscle. Okay, and also the ventral primary rami of upper three sacral nerves. That means here the primary rami of this each upper three sacral nerves are coming. These nerves are also related over this muscle. Okay, so these are the attachments we can see on the pelvic surface. And coming to the relations on this surface. So what are the relations here? So we have seen some of the relations on the base from medial to lateral. So the same thing is also related. Some of the structures are also related which are passing on the base is also related here. And this, the first one is the sympathetic trunk lies along the medial side of the pelvic sacral foramen. So here you can see the sympathetic trunk, that is the yellow one. Yes, this one is the sympathetic trunk. So this is the sympathetic trunk here. Yes, these are the sympathetic trunks which are related on the either side of the median area, or we can call it as medial side of pelvic sacral foramen. So for all the sacral foramens, the sympathetic trunk lies medial to it. And also median sacral vessels. What you called? Median sacral vessels. That is median sacral artery. So this is present on the midline. This vessel is lie in the midline. Okay, the branches only coming through the sacral foramen. Okay, and also lateral sacral vessels lie lateral to the pelvic foramen. So some of the lateral vessels which are lying on the lateral surface of the pelvic foramen. Okay, and also pelvic surfaces of bodies first, second and third sacral vertebrae. So that is first, second and third sacral vertebrae bodies are covered with parietal peritoneum. So this is also comes under the part of the abdomen, that is the lesser abdominal part called as true pelvis, isn't it? So that part is also covered with peritoneum up to 3 sacral vertebral bodies, and rectum lies against bodies of 3rd, 4th and 5th sacral vertebrae. So in this lower 3 vertebrae are related with rectum. So these are all the attachments and relations of this anterior view of the sacrum. Now coming to the dorsal view. So that is dorsal view or the posterior aspect of the sacrum here. So if you see the dorsal surface is rough, irregular and convex. So the pelvic surface is smooth and concave, and this surface is rough and convex. Okay. And which faces backwards and upwards. So this surface is facing backwards and upwards. Okay. And also there are some important parts present in this one. One is the median sacral crest. What do you call it? Median sacral crest. Here you can see the median sacral crest. Okay. And also sacral hiatus. So you can see this is the sacral hiatus, and dorsal sacral foramens. So these are the dorsal sacral foramens. Okay. And intermediate sacral crest. So this one is the intermediate sacral crest. And coming to the another crest which is present here is the lateral crest. How many crests are present? One is the median sacral crest, intermediate sacral crest, and then the lateral sacral crest. And another important parts are the sacral hiatus and the dorsal sacral foramen. Okay. And coming to the other part is the sacral corona. What do you call? Sacral corona. So here you can see this inverted part here. So that is the sacral corona. Okay, which is present on either side of the sacral hiatus. Okay, now we will see each and every one of these parts. The first one is the median sacral crest. What do you call? Median sacral crest. This median sacral crest is a raised, interrupted crest in the median plane which bears 4 spinous tubercles. So here you can see this the crest is not continuous and this crest is interrupted here. So you'll have these 3 interruptions, and these are formed by this spinous tubercles, and the spinous tubercle represents the fused spines of the sacral vertebrae, and this one gives attachment to the posterior layer of thoracolumbar fascia. Okay, so this is about the median sacral crest. And coming to the sacral hiatus, so this one is the sacral hiatus. This sacral hiatus is an inverted U-shaped gap which is present below the 4th spinous tubercle. So this is the 4th spinous tubercle. This hiatus is present below the 4th spinous tubercle in the posterior wall of the sacral canal. Here you can see this forms the sacral canal here. This is the structures. Some of the structures which are coming, this is the opening. This is the main opening of the sacral canal, and this is the ending of the sacral canal. That is, hiatus is nothing but opening. Okay. So this hiatus is formed due to the failure of laminae of fifth sacral vertebrae to meet in the medial plane. So the hiatus is present due to the failure of laminae of the fifth sacral vertebrae. Okay. And this is about the hiatus. And coming to the sacral foramina, that is dorsal sacral foramen. There are 4 in number. Here you can see 1, 2, 3 and 4. There are 4 in number, lying on each side of the median sacral crest. So these are present on the medial side of the median sacral crest. Okay. Now, it represents the articular process which are fused together. So, the dorsal sacral foramen communicate with sacral canal through intervertebral foramina and transmit dorsal rami of sacral nerves. So anteriorly, that is in pelvic hue, it allows for the passage of primary rami, whereas this foramen helps in the passage of dorsal rami of the spinal nerves. Okay. So these communicate with the sacral canal through the vertebral foramen and transmit dorsal rami of sacral nerves. This is about the dorsal sacral foramen. These are 4 in number, lying on each side of the median sacral crest. Okay. Now coming to the intermediate sacral crest, this one is the intermediate sacral crest. It is a row of small articular tubercles. Here you can see this one is the row of small tubercles. Okay. Lying just medial to, the dorsal sacral foramen. It represents the articular processes fused together. So this crest represents the articular processes fused together. Okay. And coming to the lateral sacral crest, this lateral sacral crest lies on the lateral side of the dorsal sacral foramen. It is formed by the fusion of transverse processes, tips of which appear as rows of tubercles called as transverse tubercles. Okay. So how many crests are there? Median sacral crest, which is present in medial plane, and intermediate sacral crest, which lies medial to the dorsal sacral foramen and which indicates the fusion of the articular processes. And coming to the lateral sacral crest, which is present on the lateral side of the dorsal sacral foramen, and it is formed by the fusion of the transverse processes, tips of which appear as a row of tubercles. Okay. Now coming to the sacral corona. The sacral corona is the free and projecting part at inferior part of the fifth sacral vertebra on the sides of the sacral hiatus. It is connected to corona of coccyx. So the coccyx is also having corona. So this one is connected to the corona of the coccyx by intercoronal ligament, and this one is attached by intercoronal ligament. It represents the inferior articular processes of the fifth sacral vertebrae. So this sacral corona represents the inferior articular surface processes of the fifth sacral vertebrae. Okay. So these are the bony structures which are present on the posterior aspect of the sacrum. And coming to the attachments, in the attachments it is having erector spinae muscle, arises from the area and in an U-shaped manner from the spinous processes and transverse tubercles. So here you can see the U-shaped thing. Yes. This U-shaped manner gives origin to the erector spinae muscle. So this U-shaped manner of this erector spinae muscle arises from the spinous processes and the transverse tubercles. So the transverse tubercles are related to the lateral crest, whereas the spinous processes are related to the median crest. So this U-shaped manner gives origin to the erector spinae muscle. And next muscle is the multifidus muscle. This one is the multifidus muscle, which arises from the area between. So this is arises area between from the spinous processes as well as the transverse tubercles, this area. Okay. So this one is the multifidus. So which is arising in between the transverse processes, spinous processes and transverse tubercles within U-shaped origin of erector spinae. So within the U-shaped origin of erector spinae muscle, this multifidus is located. So these are the attachments on the posterior aspect of the sacrum. Now we will see the lateral aspect. Now we are going to see the lateral aspect of the or lateral surface of the sacrum. Yes. It is formed by fused transverse processes and costal elements. So have you observed this transverse processes earlier and the costal elements on the anterior surface? These two elements are going to fuse. That means the transverse process and costal elements. Transverse process on the posterior aspect and costal elements on the anterior aspect fuse to form the lateral surface. And this lateral surface is broader above. So this is broader above and narrow below. So this one is narrow below. Okay. And it is having an articular surface. So this articular surface is an ear-shaped surface, at the upper part which articulates with the ilium of the hip bone. This articular surface articulates with the ilium of the hip bone to form a joint called as sacroiliac joint. So this area is going to articulate with the hip bone. Okay. Forming sacroiliac joint. So normally the hip bone is having a combination of bones, that is ilium, ischium and pubis. In that ilium part is going to articulate with this articular surface of the sacrum, forming the sacroiliac joint. And this articular surface is entirely formed by the costal element. Here the transverse processes are not taking part in the formation of this articular surface. Okay. And this articular surface shows some elevations and depressions, and the area behind the surface is rough. So the area behind this surface is rough for ligamentous attachments. This surface is covered by cartilage. Okay, the surface is covered by cartilage. Now coming to the inferior angle, it is the point at which the lower part of the lateral surface bends. So here, this is the bending part. Below the angle, the surface is reduced to a border. So when you come to the lower end, it becomes a border like at the lower end. Okay. Now coming to the attachments. attachments on the lateral aspect of the sacrum. So the lateral aspect of the sacrum gives attachments from behind to forwards. That means this one is behind and this one is forward. So behind to forward, what are the attachments? One is the gluteus maximus muscle. So more posteriorly it is backwards, that is gluteus maximus. Next one is the sacrotuberous ligament. So this is very important ligament, that is sacrotuberous ligament. And next comes to the sacrospinous ligament. Here you can see sacrospinous ligament. And finally and more anteriorly it is giving attached to the coccygeus muscle. So these are all the attachments from backwards to forwards. Okay. To the inferior angle, it is attached to lateral sacrococcygeal ligament, and also here at the inferior angle you'll have another attachment called sacrococcygeal ligament. And to the rough area behind the articular surface, it gives attachment to the dorsal sacroiliac and interosseous ligaments. Two ligaments are attached on the roughened part behind this articular surface, that is sacroiliac ligament and interosseous ligament, especially on the dorsal aspect, that is dorsal sacroiliac ligament. To the anterior and inferior margins, so this becomes the anterior and inferior margins of this articular surface gives attachment to the anterior sacroiliac ligament. So anterior sacroiliac ligament is attached to this area. Okay, this is about the lateral surface of the sacrum, and we will see the sacral canal. I have told that the sacral canal is present on the dorsal aspect. We will see the dorsal aspect, that canal separately. Here this is the canal. They have taken the longitudinal section of the sacrum here. So these are the bodies and these are the tubercles which are present in this, and in between them you can see the canal. So this is the continuation of the vertebral canal, of the vertebral foramens of the above vertebrae, and this is the canal here. Yes, so you can see this canal. This is the sacral canal. This is formed by the vertebral foramina of sacral vertebrae. The sacral canal is formed by the vertebral foramen of sacral vertebrae. And the sacral canal is triangular in shape, and it is bounded in front by the bodies of the sacral vertebra, and behind and on the sides by the fused laminae and the spinous process, like this. So this is on the posterior aspect, anterior like this. So anterior is commonly by the bodies, and the posterior it is formed by the laminae, fused laminae and the spinous processes. Okay, now coming to the lateral wall of the canal presents 4 intervertebral foramen. So here you can see this intervertebral foramens. Okay, this intervertebral foramen will communicate with the dorsal foramen as well as the ventral sacral foramens. Okay, here you can see these are the foramens here. Yes, these are the dorsal foramen and one is the so mainly here in this pic we can see only the dorsal foramen. Okay, so the lateral wall of the canal presents, so here we can see the lateral wall. Each lateral wall consists of 4 intervertebral foramen through which the canal is connected to the pelvic and dorsal sacral foramen. At the lower end, it is having an opening called as sacral hiatus. I have mentioned this is the sacral hiatus. Here, this is the opening that is called sacral hiatus. This is the corona of the coccyx here. So, and this one is also the sacral corona, and these two coronas will attached by one ligament. Okay, so that one is the opening called as sacral hiatus. So what are the contents present in the canal? It consists of chorda equina, including phylum terminale, that is the end part of the spinal cord, which consists of the chorda equina. At the terminal part of the chorda equina is called as phylum terminale, and which surrounds the spinal meninges. Meninges also present, and also sacral and coccygeal nerve roots and lateral sacral vessels. So these are the contents present in the sacral canal. What are they? Chorda equina, including phylum terminale, the first one, and coming to the second, which surrounds the spinal meninges, and third one you'll have sacral and coccygeal nerve roots, and fourth one is the lateral sacral vessels. Lateral sacral vessels. These are all the contents of the sacral canal. Now, what this hiatus transmits? The sacral hiatus transmits some structures out of the sacral canal. Those are fifth pair of sacral nerves. So through this hiatus, so what are the things coming here is the fifth pair of sacral nerves, and also coccygeal nerves. So coccygeal nerves and phylum terminale. Phylum terminale. So all these structures are coming out of this hiatus. 3 structures are coming out of the hiatus, but 4 structures are present in the sacral canal, but only 3 structures are coming out of this hiatus. One is the fifth pair of sacral nerves, coccygeal nerves, and phylum terminale. Okay. Now, the floor of the hiatus gives attachment to the deep posterior sacrococcygeal ligament. To the margins of the hiatus is attached to the superficial posterior sacrococcygeal ligament. So finally, this hiatus is attached to the sacrococcygeal ligaments. Okay. So this is about the sacral canal. So these are all about the surfaces of the pelvis as well as the canal which is present in the pelvis. In the next session, we are going to see the differences between the male sacrum and the female sacrum. Thank you.